All right, hello. My name is Torn Keon, and welcome to my presentation for HDF357 Family and Community Health, where we'll be discussing health disparities in the United States. And my topic for today is about Black Americans and depression. So, as for our table of contents going through the slideshow, we'll be having the summary, health disparities, going over that. We will also be talking about the biopsychosocial model, as well as the ecological model, and my references at the end of the slideshow. Moving on from this, we'll be talking about the article summary. This article by WebMD discusses the complex issues Americans suffer from while receiving depression treatment. Due to their history of being abused, unequal access to health care, too many few Black doctors, and too little information about Black people's health, many Black Americans are stuck in a vicious cycle of worsening mental health symptoms as they are not given adequate treatment or even misdiagnosed. As for health disparities, my article described a racial disparity in the mental health topic of depression. It is clear that there is a racial disparity because the article provides sources of studies that show that white doctors spend less time with their Black patients, demonstrate less of a welcoming attitude, and have numerous cases of misdiagnosing Black patients. For the biopsychosocial model, let's take a look and see how Black Americans are being affected on a biological, psychological, and social scale. First, with the biological aspect, too little information and research on Black Americans' mental health leads to inadequate treatment plans. Many are misdiagnosed with schizophrenia instead of depression. This major oversight fails to consider how genetics, inherited trauma, and predisposition to certain diseases can impact Black Americans and lead to increased accessibility and/or intensity in depression. In addition, many Black Americans are more likely to report physical symptoms of depression, such as fatigue, tiredness, loss of appetite, and aches. Without an adequately trained professional who knows about these clear signs, Black Americans may be misdiagnosed or given incorrect treatment plans. For the psychological side, historic mistreatment in health services has formed a distrust in healthcare providers among Black Americans and makes it less likely that they will seek out mental health care. Previous experiences of bias, discrimination, and lack of cultural understanding in a field of predominantly white mental health professionals has created a negative perception of mental health services. In addition, a lack of Black doctors leads to feelings of not being represented, isolation, and alienation. For social, systemic racism and socioeconomic inequality limits Black Americans' ability to seek and receive mental health services. Insurance companies' disparities make it harder for Black Americans to afford care, with 12.7% of working age Black Americans did not have health insurance, compared to only 7.5% of white Americans. Lack of diversity in the psychiatric workforce leads to less availability of culturally competent mental health professionals that can help Black Americans with culturally appropriate treatment, with only just 4% of the workforce are Black. In addition, less positive, warm, and welcoming interactions and miscommunication with white mental health professionals and Black clients create more barriers for treatment. Let's take a look at how we can intervene using the ecological model. First up, we have the interpersonal level of the ecological model. The interpersonal level of the ecological model focuses on addressing people's knowledge, thoughts, and skills. Applying culturally sensitive approaches to cognitive behavioral therapy, otherwise known as CBT, can help Black Americans have more relevant treatment and therapy. CBTs are usually effective for ethnic minorities with a variety of mental health problems, including depressive disorders. However, inconsistent methods of studying cultural competency, lack of culturally sensitive and clinically effective clinicians, underrepresentation, and limited data for ethnic minorities restrict the ability of CBT to be helpful for minority clients. Addressing said barriers and revising CBT practices to include more culturally competent methods will help Black Americans receive quality, individualized therapy that will help them more effectively and challenge the stigma that mental health services will not be of any use to them. For the interpersonal level of the ecological model, it focuses on supporting and building relationships between people to promote positive mental health. One intervention method that has helped the Black community is to create safe areas for people to freely share their struggles with depression and mental health by establishing peer support groups. These free peer-led weekly, bi-weekly, or monthly meetings allow participants to share their experiences without risk of judgment or bias. In addition, participants learn to recognize how past trauma influences our present, see each other first instead of their challenges, find strength in sharing experiences, improve their coping skills, and develop non-judgmental abilities. Going on to the institutional level, or school or work model of the ecological model, it focuses on how interactions with organizations, schools, and workplaces can support and impact mental health. By partnering with nonprofit organizations that focus on advocating for Black mental health, such as the Boris Lawrence Henson Foundation, schools, workplaces, and other organizations have collaborated to develop workshops, community speaker events, and promote awareness of resources to Black students, coworkers, and employees alike. Through these organized workshops, attendees have learned critical skills such as cultural humility, where you learn about the principles of cultural humility, develop empathy for cultures, and recognize awareness of your own biases, including your own. Second part is developing practical skills and workshops to improve communication across cultures and create more positive connections to build bridges among people. The third is how to create actionable strategies to implement lasting cultural humility in organizations long after the workshop ends. Now, for the community level of the ecological model, it focuses on how interactions with the person and their connectedness to a positive community can support mental health. Campaigns from trusted centers such as the National Institute on Minority Health and Health Disparities, otherwise known as NIMHD, their Brother on Your Mind Toolkit campaign, community events, and setting up pop-up mental health clinics in underrepresented communities are options for community intervention methods. An additional part about these pop-up clinics, it helps distribute mental health services when other communities don't have as readily accessible access to them, such as transportation or when it comes to the location. And it's a great way for mental health services to get that out and get the support to these communities. Forming positive relationships with schools, community organizations, and faith-based institutions enhances the acceptance and delivery of stigma reduction interventions. And this is concerning mental health stigma. Utilizing these programs to reach more Black communities, such as youth groups, churches, retirement homes, and more, will promote mental health services and offer greater accessibility while establishing pro-social mental health behaviors. Now, for the ecological model, we'll be talking about the policy level. The policy level of the ecological model focuses on how legislation, laws, and addressing systemic barriers to proper healthcare can impact mental health. Advocating for policies such as the Equity Action Plan, Executive Order 13895, and Executive Order 1491 can help break up the struggle for Black Americans' access to healthcare services and address problems beyond the mental domain that may be influencing their mental health. Plans such as these charge federal agencies with proactively addressing the systemic barriers that impede equal opportunity for underserved communities, where the 2020 Equity Action Plan identifies 5 key areas of focus, backed by evidence-based research and informed by public input. For the next steps, with implementing more of these evidence-based intervention methods at each stage of the ecological model, first, we'll run through all of them again. At the interpersonal level, we have applying culturally sensitive and clear methods to cognitive behavioral therapy and representing the Black community more and accurately in healthcare. The interpersonal level, we can foster more opportunities for Black peer support groups. At the institutional level, we can collaborate with nonprofit organizations for workshops in professional and school settings. At the community level, we can create campaigns, pop-up clinics, and reach out to Black communities and leaders. For the policy level, we can advocate for governmental policies that promote equitable service for underrepresented communities, such as the Equity Action Plan. Together, we can work to promote, encourage, and implement more effective health services for Black Americans struggling with depression and mental health. Thank you for taking the time to listen to my presentation. And the next slide will be a list of the references that helped me out in my study of this project. Thank you again, and that is the end of my presentation for HDF357's Health Disparity final presentation. My name is Torin Keon, and thank you for your time.